have a lot of interest in water access in vulnerable population, specifically in people who inject drugs, who are also deportees, and in homeless, and are homeless, who lives inside the Tijuana River. It's a binational river, and also in refugee communities in Mexico and in other areas of Asia and Africa.
Thank you. Great. Jesse, would you like to introduce yourself?
Yeah. Hi, everyone. I hope my microphone's working. Sometimes I have issues with headphones. Awesome. I'm Jesse. I'm a postdoctoral researcher at North Carolina State University. I work on sanitation stuff, and I've done some pilot work on poor wash access among the Bedouin people in southern Israel, which is my introduction to this concept, but overall it's pretty new to me, and I'm excited to be part of it.
Great, thank you. And Dr. Hanan Mudahir, would you like to introduce yourself?
Hello everyone. This is Hanan Al-Amin from Sudan. Actually, I'm a civil society organization, focal point for SAWA, Sanitation Water for All. As you know, maybe most of you know of it. At the same time, I have a PhD in strategic studies concerning the issues of ocean. At the same time, I'm an environmental and water activist. Thank you.
Thank you so much. Anna, would you like to introduce yourself?
Hi, this is Anna Cucarulo. I'm with DevWorks International as a program manager. I've in the past have supported WASH projects in Nepal, Uganda, and Indonesia. But I'm currently working on ag, so it's nice to always come back and talk about WASH. Because I've been working on, projects with USAID through more international lens, I'm excited to talk about perhaps more through domestic. Something that kind of struck me in the presentation earlier was the stigma that providing safe sanitation and water access could, quote, encourage or enable homeless communities. I know we're talking about more than unhoused communities, but it was something that really struck me that gets to the point of this issue of people not recognizing water access and safe sanitation as a human right. So that was just something I wanted to share now while we're introducing. Thank you.
Great, thank you so much. Rebecca, would you like to introduce yourself?
Sure. Hi. Yeah, I'm Rebecca Gennady. I work for Ohio State University as a research associate. And yeah, I similarly was struck by a lot this morning. I'm originally from Perth, actually, where Jordan is, and working now with the Navajo Nation. And so a lot of the words this morning rang true. And I'm still struggling with the idea that things can be in policy and yet and I know it's not limited to water, but can be completely ignored, and whole populations can be completely ignored. I think in the US, it's so much more visible because it's such a big country and such an impactful country on the world stage, but interested for this conversation.
Great, thank you so much, Rebecca. Joana just was a speaker in our session, and she was actually the speaker talking about unhoused population in Los Angeles. Would you like to introduce yourself?
Yes, sorry I had to move. I'm Joana, I'm a postdoc fellow at UC San Diego, and just like Aleli, I'm working on the experiences of WASH security now among people who inject drugs between Tijuana and San Diego. But I'm really passionate about work on, that's affecting unhoused communities in the global north, so I'm really excited to be here and learn from you all.
Great, thank you. So our session really is about the human right to water and sanitation. And I think recognizing that there is this human right to water and sanitation, we want to think about different policies and ways in which we can get there, because there are still lots of communities in these high income countries and low and middle income countries, but we're focusing today on high income countries. But there are lots of communities that don't have that access to safely managed water and sanitation and basic hygiene. So what we've started to sort of fill out this Google Doc, and we have some great words describing the people's thoughts. If anyone wants to add to that, that would be great. But the next sort of question that I thought we would discuss together was, what WASH inequities do you see? And some of you have already talked about some of those, and we've put some of that down. But if there is anything else that people would like to add to some of the WASH inequities you see from in places that you work or that you've heard about, maybe that we haven't heard already about. So we've heard from quite a few speakers in our session and then also in the plenary. But if there are others that you think of or that you work with, it would be great to sort of capture that. Does anyone want to add to what some people have already discussed?
Yes, I would add also onto that some of the other stigmatized populations, whether it's sex workers or whether it's particularly prison populations, people who are, somebody said it in one of the earlier sessions, people who are deemed undeserving for some reason. And I think that there are institutionalized populations who are regularly ignored, or whose human rights are just, put to the side.
Great, thank you, thanks. So does anyone else have any other groups that they'd like to add? Okay, I've sort of gotten a little bit of a message that I need to move a little faster. We spent a little time with introductions, but I think that was great. It really gave us a sense of who's in the room. The next two questions we want to try to answer are, what are the challenges in the implementation of the human right to water and sanitation? And how do we bring universal access to water and sanitation to all? So that next question is pretty big, but maybe we can talk about some of the challenges and try to think about some of the ways to address those challenges. Does anyone have any thoughts? I know that the presenters tried to hone in on this, but it would be great to hear what people are thinking along these lines. So challenges to implementation of the human right, and then what can we do to address those challenges? Anyone have any thoughts on that?
I think something that I keep hearing, coming from the US context, is we haven't acknowledged the human right, and it seems like there's some fear or disagreement, right? So specifically thinking about unhoused populations is that if we say this is a human right, then we will increase. So I want to focus on like correcting those misunderstandings somehow, so that we can get towards this, just establishing the human right as law, and then we can talk about enforcing the law.
Great. So acknowledging the human right. And Dr. Mutahir, did you say that, I saw you unmute yourself for a second. Did you want to add anything?
Yeah, hi. I would like to add the word of accountability. Accountability should be like as one of the models, or one to be imputed in the system itself. Because without accountability, we couldn't receive good services. Especially when we talk about the human rights and receiving basic services, especially water supply or even sanitation, or even if there is any something like relevant team as such or in general. So that means accountability and monitoring. Otherwise, we couldn't receive really like human rights for everyone, to base or to reach all those basic services in one time. Thank you.
Great, really great. So thinking a little bit more about accountability and then even monitoring, right? So who doesn't have access to these services? Where are they? Where do they live? And then why don't they have access? Rebecca, did you want to say something?
Yeah, two things occurred to me. One is that water is not something that makes money, as in you don't invest, like you invest in energy and energy makes money. You invest in an industry and industry makes money. You invest in water and the economic returns are, they are indirect in terms of the impact on people's health or productivity resulting from good access to water, but it's not an industry that itself makes money. And I think that impacts the financial incentive for people, governments, industry to really focus on it and invest as much as they should. And the other thing that occurs to me in high income countries is the sunk costs of prior investment and the unwillingness of governments to spend more money on things that they think they've already spent money on. And so like Flint, Michigan had pipes. Why would we replace pipes? Oh, because now everyone knows about it. Like now we're being shamed for it, so we'll replace. But I think where there is sunk investment, the governments are very unwilling to improve or add.
Great, thank you. So I think what would be great is if we could all move to two other questions that we need to, or we want to try to sort of think about and answer during this session. And one is what sort of policies and programs could be expanded? And you can speak directly about specific ones or generally about general policies and programs that could be expanded upon or changed to increase access to water, sanitation, or hygiene, or all three. And then also, if you have any thoughts about concrete calls, so that we could, if we could actually, submit to policymakers. If you have any thoughts on calls to action for high-income country policymakers, please feel free to also share those. So think about policy programs that are working, that could be expanded, and then 3 to 5 concrete calls to action. So any calls to action that you could think of. And I'll just add one program that I think could be expanded upon or changed, or really expanded upon, is this technical assistance. So it's there's a model in the United States that's also operating in Canada and Honduras. It's called the Circuit Rider model. It's essentially providing technical assistance to water systems. And these are small and rural water systems. They provide training in how to monitor systems, to raise funds, to keep systems sustainable. And these technicians travel around to communities to try to help them in sort of all of these areas in some cases, or 1 or 2 of these areas. It's one program that I think has been expanded from the United States to other countries, but I think it could be further expanded. And I'd love for anyone else to comment on other programs or policies that they've heard of that they know are successful, and or any calls to action that you would like to really put out there. Does anyone? Feel free to just, there's so many of us, there's not a lot of us, so you don't have to raise your hand. If you'd like to speak, go ahead. Dr. Mudahir, I see you unmuted.
Yes. Actually, one of the systems can work very well because we use it actually as civil society organizations, the advocacy. The advocacy is playing we have it as a big role, even with the media, not just with the public and citizens, but and to let them know their rights towards receiving basic services from water and sanitation. And even the media engage with us in a sort of campaigns, and usually we are giving or producing or submitting at headed papers, documents to the ministers in concern, like Ministry of Water or Ministry of Health. And actually it has been playing we have it really it's as a good example, especially in Sudan. So something like that can be intervened, this advocacy tool. At the same time, we need really a code of conduct, because if we need really to address the challenges, that means even on the national level, to have a code of conduct to play the role in giving like the basic services, at least for the humans, for water and sanitation. That means not just within the legislations and standards given, or even the regulations, but even to have a code of conduct. It's the term of constitution or something, can be like most of the stakeholders or partners play their role on it. Yeah, thank you.
Okay, I wish we sort of had more time together, but I would encourage any of you to comment on and in the Google Doc if you have further thoughts or ideas. We're trying to sort of capture all of this and even put together a few concrete calls that we could share with all of you and with policymakers. So if you have any additional thoughts, feel free to add them to that Google Doc, but we are being asked to return to the main session. And I really want to thank you all so much for participating in this breakout room. I really appreciate that. And it was wonderful to meet you all. And I hope that we can actually carry this conversation on. I'm hoping that this group can continue to talk and discuss. So, and that we can continue to work on this, on some of these questions and on these calls for action. So thank you so much for participating in this breakout and in the main session, and for those of you who are able to attend the plenary as well. All right, so if you want to return now to the main session, that would be great.
Thank you.
Thank you.
Thanks, y'all.
Thank you.
Thank you.